leaked. And what you want to make sure you do is you're pushing in and angling up underneath this rib. And what I do is I start at the dome of the right lobe and then take sequential pictures as we come down. So the first picture I get of the right lobe is just the parenchyma. You're above all the hepatic veins and portal veins. And then as you come down, you're going to start to see the hepatic veins come into view. The walls of the hepatic veins are less echogenic than the portals, and that's usually a good tip-off that you're seeing the hepatic veins. Besides that, you can also see them obviously go directly into the IVC. And then that's my second picture of the right lobe. The third picture of the right lobe you're going to take with the portal veins. If you were looking for any ductal dilatation, this is where you would see that at the level of the portal system. And from there you just sweep all the way out of the liver. So that's the sagittal sweep through the liver. Next we go is transverse, and for that we're going to start again with the left lobe, subxiphoid, and you kind of grab the top of the probe here, and you want to make sure you sweep all the way up through the left lobe till you see the heart. And then as you come down, very similar protocol, you start at the top of the left lobe with the parenchyma. Coming down, you'll see the hepatic veins. And then last, you're going to see the portal veins. And you sweep all the way out of the left lobe here. You want to make sure you're sweeping through every organ, because if you don't sweep, you probably miss some anatomy and possibly some pathology too. So now from the left lobe, which is right here, you're going to angle slightly over and you should see the right lobe come into view. So you angle all the way up through the dome of the right lobe and start to come down. You get the parenchyma. Coming down, you'll see the hepatic veins again, and then you'll also come into the portal. And from here we just sweep all the way out of the liver. And now we're going to go to an intercostal window. So after you finish your transverse sweep subcostal through the right lobe, we're going to move to the intercostal window. And for this window, you're going to want to make sure that your probe is slightly obliqued, because you want to fit in between each one of these rib spaces to get the best view of the liver. And you start again up at the top of the liver, and you sweep through the top rib space here. Next you come down a rib space, sweep through again. As you're doing this, you're still getting those same pictures, one at the dome of the right lobe, one at the hepatic veins, and then as you jump down, you'll get a picture of the main portal vein, and you can also see the main portal from this window split into right anterior and right posterior portal vein. At the last rib space, you should start to see the upper pole of the kidney against the liver surface. From here you can kind of judge the echogenicity of the liver and the kidney, and then as you turn coronal, you'll be able to evaluate if there's any liver enlargement. The right kidney and the liver tip should both end at about the same spot. The whole time you're going to want to make sure that you're sweeping through the liver completely, just again to make sure you're not missing any pathology here. Next we're going to show you how to image the gallbladder, and you can really use two windows depending on which one works best for the particular patient. One of the two windows that I usually use is a subcostal window, and your probe may be slightly obliqued. to the patient's body, but essentially what you want to do is open up the gallbladder completely. And so again, you might not be perfectly sagittal to the body to get a sagittal gallbladder. And from here, once you find that elongated gallbladder, you just sweep through. Next, we'll get a transverse image of the gallbladder in this same window. And what you want to do is just look at your probe and kind of think about in your head, if you turn your probe 90 degrees, you should be perfectly set up for a transverse gallbladder. So this is our transverse plane, and if you go back 90 degrees the other way, this should be your sagittal plane here. Another real good window for the gallbladder, especially for bigger patients or gassy patients, is if you come intercostal and you're going to kind of angle up towards the anterior part of the abdomen. Again, you're just going to open up the gallbladder to get its widest portion here. And same thing, once you find that sagittal window, to get a transverse, look at your probe and turn it 90 degrees to that plane. For the gallbladder, we also get decube pictures just to make sure there's no stones trapped in the fundus, in the neck of the gallbladder. So for that, I'm going to have you turn onto your left side away from us. And for this, the gallbladder usually moves a little bit forward. So after you get your supine pictures of the gallbladder, you want to make sure you decube the patient just to make sure there are no stones that are stuck in the neck of the gallbladder. You have the patient turn on their left side away from you, and that usually brings the gallbladder forward here. So we're going to kind of come subcostal here and just kind of sweep through, and you should see the gallbladder very anterior here. And I like to start in a sagittal plane from here. You just want to make sure you sweep through the gallbladder here, and if there are any stones, they should drop into the fundus of the gallbladder from this plane here. This is also good for opening up the neck of the gallbladder to make sure there's no stones that are impacted in the neck of the gallbladder here. Once you get your sagittal sweep, you're going to want to make sure you, again, turn your probe 90 degrees and just sweep through in a transverse plane just to make sure you're not missing anything. You can also see the porta hepatis and the CBD from this decube position as well. For this, you want to elongate the main portal vein, and you'll see it track right up into the liver. And then once you find that, you know that the CBD and the hepatic artery are right next to each other here. So you just kind of keep tweaking the probe until you find, or till you elongate, one of these tubular structures next to the main portal vein. And the easiest way to see if you're on the hepatic artery or the CBD is to just turn on color and see if it lights up. If it lights up, you are on the hepatic artery, and if it doesn't, you know that's the CBD. To image the pancreas, which is what we're going to look at next, you want to come subxiphoid again, and what I would do is come up high and angle down. That way you're using the tip of the left lobe of your liver as your window. Instead of coming down low and angling up, you're going to use bowel, which is never a good scan window in ultrasound. So we're going to come up high, angle down, and the other key is you want to oblique your transducer slightly counterclockwise. This will set you up for a nice sagittal pancreas image. And if you look on this image here, you want to just see that splenic vein is a good landmark to let you know that you are very close to, if not exactly on, your pancreas. And like every organ, you need to sweep through. If you just see the splenic vein and you take pictures here, you can miss other pathology in the pancreas. And we'll also try to look at the head and uncinate process here all the way down to the tail of the pancreas. Most patients, you probably won't be able to see the entire tail of the pancreas just because it kind of dives deep from this position here. When you're looking at the pancreas, you want to look for certain structures in the pancreas as well. One of the structures that we can look for is the pancreatic duct, and that runs right through the body of the pancreas, you know, throughout the entire length of the pancreas, let's say. And you can look here. A lot of patients, you will be able to see the pancreatic duct, and we usually use 2 millimeters as a cutoff for our normal pancreatic duct measurement. If you angle towards the patient's right side here, you'll be able to see the head and uncinate process of the pancreas. If the patient is a good scan, you'll may be able to see the gastroduodenal artery, or GDA, in the anterior head of the pancreas. And then in the posterior head of the pancreas, you'll probably be able to see the CBD if the patient is a good scan. All right, and if you find the CBD, you can also turn sagittal to the CBD from this position and elongate it as it goes into the liver. If you do see anything in the pancreas also, you could get transverse images of the pancreas, which for that your probe will be in a sagittal plane to the patient's body. As you sweep through the pancreas in a sagittal plane, you can use other structures as your landmarks to know where exactly you are within the pancreas. So a good rule of thumb is if you're seeing the aorta posterior to the pancreas, you're in the pancreatic body. And as you sweep more towards the patient's right side, when you see the IVC, you know you're in the pancreatic head or around the pancreatic head part. And as you sweep through, you can just evaluate the pancreas in a transverse plane here. So to image the spleen, you're going to come to the patient's left side, and again, you're going to want to make sure you're scanning right in this rib space here. So your probe is going to be slightly obliqued. And once you find that rib space, you'll feel the probe drop down into it. And from here, you just want to make sure you're sweeping through that entire rib space. For the spleen, we usually measure, once you get to the maximal dimension of the spleen, we usually measure the length of the spleen in this window here. And you sweep through the spleen completely in sagittal. For your transverse images of the spleen, you may see some of those rib shadows in your view. But all you could do is just kind of angle, maybe come a little more anterior or posterior to get around those ribs, and just kind of sweep through as much of the spleen from these different windows as possible until you feel like you've seen the entire spleen. To image the left kidney, we usually have the patient turn up into a right decube, so they're facing you, and you're going to kind of, usually you're going to be below the rib spaces here. And the important thing to remember for the kidneys is the upper pole of the kidney is going to be slightly more posterior. The lower pole is going to be more anterior. So you're going to have this kind of oblique transducer position. And when you get the kidney, you probably will also see the spleen in this window as well. And you just want to make sure again that you're sweeping through the kidney in its entirety, lateral to medial. And then what we usually do from here too is we take transverse images of the left kidney. And the easiest way to find a transverse is, again, just look at your probe and think about how you're going to turn 90 degrees to that sagittal image. And you're going to sweep all the way up to the top and down to the lower pole towards the bottom of the left kidney. For these transverse pictures, you may run into the rib spaces, the ribs a little bit. And what I would do is, if you have to, you can use that intercostal space and just sweep through that if you feel like you're not getting a very good image of the upper pole or lower pole of the kidney. And you'll also see if there's any, you'll also see the spleen from this window again too. Okay, another window we can use to get the porta hepatis and the CBD is this intercostal right window again. This is a good window for if you're going to do any pulse wave Dopplers, because usually the main portal vein sets up at about a 60-degree angle. So you get good color fill, and your pulse Doppler is also, you have an accurate pulse Doppler measurement if you need it. So once you find that main portal vein, which you look for the echogenic walls, you elongate it, and from there you know that the hepatic artery and the CBD are going to be right next to it as well. So once you find the portal, you can kind of just keep tweaking the probe until you elongate the CBD completely. And if you're not sure whether or not you're on the CBD or the hepatic artery, just put the color on. Whichever one does not fill with color is the CBD.